New infections are on the rise in Europe despite the partial lockdowns imposed in many countries. France's Prime Minister Jean Castex says the number of coronavirus cases in hospitals is now higher than it was last spring, with a new patient admitted every 30 seconds. Hospitals are also under strain in Italy, Europe's ground zero in the pandemic. This time, it's not just the rich north that's affected. The second wave is also stretching resources in Naples and the poorer south.
Coronavirus patients wait for hours outside the emergency ward at the Cotugno clinic to get treatment. Relatives have brought them here in their own cars. We've looked all over Naples for ventilators and haven't found anything at all. Hospital staff treat them as outpatients. The area around the Gulf of Naples is seeing a huge second surge in coronavirus cases. After Lombardy, Campania is the second hardest hit region in Italy. Antonio Cardarelli Hospital is the biggest health centre in the south of the country. Dr. Giuseppe Visone works in the emergency ward. A year ago, things were already tense here, even before the onset of the pandemic. After his shift, the doctor emerges. His state reflects that of Italy's health system. He's exhausted. The system is right at its limit. We're using all possible resources in order to treat patients. But now it's coming down to a question of pure math. There are so many patients, the system is unable to accommodate them. On the weekend, these images from Naples' seafront promenade outraged Italians across the country. But the national government still designates the Campania region as level yellow, not red. Critics say the region's crisis department cooked the figures to avoid a lockdown when they registered ICU occupancy last week at 27%. The president of the Italian Doctors Association is worried. He wants all of Italy to be designated a red zone. The government is trying to serve various interests, namely economic as well as healthcare. Of course, the economy is important, we understand that. But if the curve continues to rise, Italy's healthcare system will simply not be able to handle it. Doctors and nurses are honored in these figures by craftsman Gennaro De Virgilio. His store is on the popular shopping street of Via San Gregorio Armeno, now empty. Gennaro is worried about the future, both for his health and his business, in the city of Naples, at the foot of the famous volcano, Mount Vesuvius.
And here in Germany, there have been a record number of new cases, with nearly 24,000 infections registered in the last 24 hours. Half of all hospitals are reported to be stretched to capacity. Germany was able to boost its number of intensive care beds during the first wave, but as we report, trained nurses are increasingly in short supply.
Ina Scheller is an intensive care nurse. She finished her specialist training at the end of October. Now she's caring for a coronavirus patient in intensive care at Düsseldorf's University Hospital. We've moved him around so that he lies in different positions and doesn't get bed sores. My colleagues will take some blood for a blood gas analysis, which will tell us how to adjust the ventilator. Things that the 30-year-old nurse cannot yet do alone, having passed the state exam and completed 3 years of training. For 2 years, she assisted on the ward with supervision. Then, after 2 more training years, she became a specialist nurse for intensive care and anesthesia. That's all about ventilation, what to consider when ventilating, which settings are there, and also types of surgery in more detail. You also get a deeper insight into anesthesia, the sequence of operations. The job is medically, technically, and personally challenging. That's why nurses cannot simply start working in ICU after their basic training. Louisa Janssen is 25 and just completed her first year of specialist training, 8 months of it during the pandemic. Together with a colleague, she cares for a seriously ill coronavirus patient. After 1 more year, she will be able to do this on her own. There are patients who should have one-on-one care, and of course we try to provide it, but sometimes it doesn't work out because we don't have enough staff. That, even though the job pays well. After training, German nurses earn an average of 3,500 euros per month before tax. And those doing shift work in ICU receive additional bonuses. But high stress levels, big responsibilities, weekend shifts, and a lack of recognition are all deterrents. Sure, raising the wage could be an incentive for staying in the job. And it could attract others to choose this line of work. I do think we could be paid more, considering the work we have to do. And I'm glad that this is currently being discussed more. And so the coronavirus pandemic may even bring about change. We were just taken for granted. The issue wasn't addressed the last few years. Many people don't know what nurses have to deal with on a daily basis, especially intensive care nurses. And why not just anyone can do it? Louisa Janssen wants to finish her specialist training despite and because of COVID-19. These nurses know the coming weeks will be tough, but say they will somehow manage.
Let's take a look now at some of the other developments in the pandemic. Delhi is reporting 104 coronavirus deaths in the past 24 hours. That's a record high for the Indian capital. Many hospitals say they've run out of intensive care beds. South Korea has begun fining people for not wearing masks in public places. Israel has signed a deal with drug maker Pfizer and BioNTech to receive 8 million doses of its coronavirus vaccine next year. And New Zealand has reopened downtown Auckland after tracing a new coronavirus case to a known cluster. Well, here in Germany, not everyone agrees with the measures being taken to curb the spread of coronavirus. But a new poll suggests most Germans actually support the government's policy. It shows that although 26% of Germans think the measures go too far, 54% of people in the country think they're appropriate. And 18% even say the measures do not go far enough. Earlier, we spoke to Reinhard Schlinkert. He's the managing director of Infratest DIMAP, which conducted that poll. He told us what impact coronavirus policy is having on the German government's approval ratings.
The CDU, the Christian Democratic Party, Merkel's party, goes up and up and up. She has an approval rate now of 3/4 of the population. The government has an approval rate of 2/3 of the population, something we never have seen in the last 30 years. And the approval rate for the measures, for the corona measures, are in principle quite high, but the lowest appreciation rates we have, that's for the closure of restaurants. Only half of the population agree to that, and half of the population only agree to the fact that it's no longer allowed that if you're a tourist that you can spend a night or some nights in a hotel. That's not so positively received. But overall, we have an acceptance rate of nearly 80% in Germany.